Our second project to shine a light on is the local partnership agreement with Jade Cronan Thompson and Meg Taylor, but this isn't Meg Taylor, this is Carol Fayer.
An older version.
Yeah, older version of Meg, from Metro North. So I'll introduce you, Jade from Footprints and Meg from Metro North. Go for it.
Thank you. Thanks, Anne-Marie. Hope we've got you before the drop in blood sugar after that amazing dessert that we had at lunchtime, before that post-lunch slump. So we're going to talk about a local partnership agreement that exists between Metro North Mental Health, BHC, BRIC and Footprints, and it's quite a recent innovation. Okay, so the background to this partnership was, it just relates to two issues that were identified by the Service Integration Coordinator, that the problems were that there was lack of housing, or that there was inappropriate housing available for consumers that were being discharged from the inpatient unit of the hospital, and also that there were some tensions between Metro North Mental Health and housing, because they felt really quite unsupported in dealing with clients from our service. So there was, Okay, and then there was also a systems barrier identified, which was that there were time delays to discharging consumers from the ward into housing. So the other thing is that, so the lack of housing stock per se was one issue, but the scarce stock also created another problem, and that was often clients were housed in less than desirable, sort of not best fit, so to speak. And so what happened then was that we had a problem with readmissions, which resulted then in an increased length of stay. There were tenancy breakdowns. There was a high turnover of tenants in the community housing. It was also noted that social housing providers would often call mental health service about clients who were exhibiting drug and alcohol related or antisocial behaviour, rather than symptoms of an actual mental illness. And so they also felt unsupported at times, and that felt as if they were just having clients dumped on them. So it was then identified that something really needed to be done to address these issues, so that once the clients were housed, they could benefit from some sort of a wraparound approach, and just to provide support and to enable them to sustain their tenancies. So this local partnership agreement is a mechanism whereby the mental health service and community housing could work collaboratively with the NGO, and we could coordinate resources to house consumers from the inpatient unit at the Royal. And so we have regular meetings where we discuss the new referrals, but it's also served to enhance and to build the relationships between all of us, which obviously ultimately benefits the clients. So the other thing is that this LPA has clarified the roles and the responsibilities of that we each have. It is an agreement that is still in its infancy, and the hope is that it's a pilot project, and the hope is that it will obviously be reviewed after a year, and we'll see where we'll go from there. So Jade is going to talk to you now about where we are now and the challenges that we've had as well.
Thanks, Carol. Oh, I just need to shake off my public speaking nerves, which may not actually happen. So where we're at now, I guess in June this year, the partnership agreement was signed by Brisbane Housing Company, BRIC, Footprints and the RBH. And we've had 2 housing referral meetings since then. I'll go into the challenges faced, because that's really important in understanding where we're at with those housing referral meetings and sort of where to. But with the housing referral meetings, so a person is referred in by a mental health clinician to the housing referral meeting. At that housing referral meeting are a representative from BHC, from BRIC, from Footprints, PIR and Carol. And so the person attends, the ideal is that the person also attends that meeting with their clinician or with an advocate. And the idea is that the person gets to meet the property managers and have a really robust conversation, so that the referral isn't just a person on a piece of paper, they actually get to have that human interaction. So we've had 2 of those meetings, and I guess with regards to challenges and housing people that are referred to that meeting, is that I mean, the biggest challenge is housing availability. I mean, why develop an LPA when there's no housing stock? So we really had to reflect on what we're going to be doing in this space. And I guess, like, one thing that is an opportunity, I guess, that we need to explore a bit further is how to tap into the private market as well. Social housing is clogged. All the other care coordination meetings, housing care coordination meetings are also clogged. So we need to be looking at other housing options, but also in the housing referral meeting, if there is a vacancy that comes up in BHC or BRIC and the consumer is put forward to that, then we can look at, as Carol was mentioning before, the best fit. So where, where a person may have a best chance of sustaining their tenancy. So one of the things we do look at in the meeting, and particularly around housing availability, is looking at the environment, sort of environmental design of where that vacancy may be, and also looking at, is the unit in a high density block? Is that going to suit someone, or is it in a sort of a lower density complex? The other thing there that I put in there, which is just my thing at the moment that is, really annoys me in the sector, is the wraparound support from NGOs, and particularly the wraparound support regarding the HAC and the Queensland Community Care Support for people over 65 and for the QCC for people under 65, and the lack of availability for that wraparound support once someone is housed from the ward. So one of the things that we're sort of looking at, I guess, in the beginning phase is not necessarily in this partnership, but sort of more long term, is what can we do in that space for people under 65 with severe and persistent mental illness who need that wraparound support to sustain their tenancy. Am I making sense? I feel like I'm rambling. So where to? Goals. One thing I did want to say actually before I move on to that is that, so the partnership is not just about housing someone. I mean, that's the ultimate goal. That's what we'd really like to do. But the partnership is also about formalising relationships. So it was a really good opportunity to get two key players in the community housing sector to sit down with the mental health sector, or the Queensland Health, and to sign off and say, well, we agree that we're going to work in a collaborative, recovery-focused manner. So yes, those relationships may have been happening in the past to some degree, but to have people sit down and sign off on that and say, well, this is what we're going to do in the future is really important. Whether or not there's housing stock at the moment, we can then use this partnership to sort of explore expanding housing options in the future. So where to? Goals. I think I may have just covered that. So yeah, I guess one of the big outcomes was to help people be sustainably housed. But one thing that we'd really like to do is increase the capacity or response of the housing sector, both the private and social housing. And this partnership is a tool to be able to work together to look at doing that. I think that's about it. I think I'm done. That was really quick. Questions? I'd normally put a cat picture in, but that was done before, so I won't. So, yeah, if you would like any more information on the LPA or how to refer in, if you could either please contact Carol or myself. So, thank you.